Hello everyone, I'm Sanchika. I'm from Eco India. I welcome you all for the Sipher Eco webinar on good and replicable and innovative practices of tobacco control in India. Today's topic is very important and it's on ends ban in India, which will be taken up by the President and Director of Public Health for the Sipher Institute, Dr. Rakesh Gupta. Now I will invite Mr. Arun Verma, Director of the Finance and Operations in the Sipher organization for the welcome address.
Please, next slide. Thank you, Dr. Sanchika. Good evening to one and all who have joined as participants or as dignitaries. I, on behalf of the organizers, Sipher, RCTC, PGI, and technical support by the Eco India, I am delighted to welcome all the participants and the dignitaries to this webinar. I thank Ms. Preeti Sudan, our former Secretary, Health, Ministry of Health and Family Welfare, who will be likely to join maybe in a short time now because she's busy with the meeting at this moment. I welcome Dr. Adarshpal Kaur, Director Health Services, Punjab, Chandigarh. Probably either she has joined or she's likely to join in a few minutes from now. I welcome Dr. Rana J. Singh, who is the Deputy Regional Director, Union Southeast Asia. I also welcome Ms. Sanchika Gupta, Dr. Sanchika Gupta, Manager Projects Eco India, who is I'm responsible for coordinating this webinar as well as hosting this webinar. I welcome Mr. Rajiv Chaudhary, who is the Program Coordinator, Regional Center for Tobacco Control, and our eminent participants and public health students. As you know, Strategic Institute of Public Health Education and Research, known as Sipher, was established way back in 2018 with the fundamental purpose of creating a specialist public health workforce that can plan, execute, and monitor national health program and public health initiatives for tackling emerging public health challenges. We are working on all public health issues with the special focus on non-communicable diseases. In the last more than 4 years, to be precise, 51 months, we have organized more than 90, and we are today 91 physical as well as virtual workshop and consultation webinars. Our other coordinator organizers with this for this webinar is the Resource Center for Tobacco Control, PGI, a joint initiative of PGI, MER, Chandigarh, and the Union. Is emerging as one of the most sought after platforms that showcases tobacco control initiatives, updates, policies, resource materials, etc. from length and breadth of the country. It has helped in strengthening the National Control Tobacco Program to a great extent. Thank you so much. Over to Dr. Sanchika.
Thank you so much, sir. Has Mr. Rajiv joined? I think we will take him later.
Yes.
Yes, okay. So now I would request Mr. Rajiv Chaudhary, who is the project coordinator at the Department of Community Medicine in the School of Public Health in the PGI Chandigarh. He has worked with multiple institutions and of national recognition and is an exceptional public health professional. Now I will request Mr. Rajiv for discussing on the objectives of the webinar.
Thank you, Dr. Sanchita, for giving this opportunity to sharing the objective of this webinar. Actually, the resource center under the Department of Community Medicine, PGI Chandigarh, conducted one national conclave of best practices under NTCP program with the aim to compile all the various good practices, undertake various state and the national level best practices to document these for the implementation of other states. So it may help to effective implementation of Empower and NTCP for effective and tobacco control and nicotine control. So we have successfully compiled the 25 practices in GRIP 1, the first edition of these case study booklet, and we are still working for the second edition of the case study booklet, and it may come in next 1 or 2 months. So we are already compiled another 20 best practices across India. So and today discussing and like we know that Sipher was the collaborator in this event, and these case study cover almost every area of related to tobacco control for advancing leadership, management, tobacco control in India, and also highlighting the various issues, the best practices like TOFI implementation and implementations, taxation policy and all, and other various school practices and all. So by this booklet we are going to do, and today is very important topic initiated like taken by the Dr. Rakesh Gupta sir, and the presentation by the experts will help in increasing awareness, facilitating cross-learning among the stakeholders for strengthening the National Tobacco Control Program in the country, and sensitizing the stakeholder on best practices for its replication in the other state. And this today's presentation is just a highlight journey of by the Punjab government banning e-cigarette in 2013, and that the secondly a public health threat e-cigarette and by Dr. Rakesh Gupta sir, and overview of end ban in India, Ms. Preeti Sudan ma'am, a former Secretary Health MOHFW. So this is actually the brief objective of this this particular session. So I hand over to the co-host only to proceed with the further proceeding.
Thank you so much, sir. Now we will move forward. Ma'am will join with us.
She's already with us. She's already with us.
Okay, now I will request Madam Dr. Adarshpal Kaur, who is an eminent surgeon and has served as SMO ESI Hospital Mohali and a civil surgeon in Mohali for almost 2.5 years. She has joined in last month as Director of Health and Family Welfare Department in the Punjab. Her main priority is to bring more improvements in the health services being provided to the people of the state and implement the state and central government schemes, specifically health schemes and programs effectively in the state. Over to you, ma'am.
Good afternoon, Dr. Sanchika, and thank you. Am I audible?
Yes,
yeah, you are audible.
Thank you, Dr. Rakesh. Thank you, Dr. Rajiv, and thank you all the participants and the dignitaries over here in this meeting. So I am a proud sharer of the fact that Punjab was the first state to ban e-cigarettes. The ban was imposed right way back in 2013 in the month of September, when we issued notice to e-commerce sites per se, and also imposed ban on storage, sale and purchase of e-cigarette. As we all know, the e-cigarettes are much more harmful than we can anticipate, because these are glamorized and youth, they are tempted towards this. So we took a lead in Punjab, and Dr. Rakesh Gupta did a wonderful job in this. So thank you very much. Thank you all the participants. And I just request Dr. Gupta to proceed.
Thank you, ma'am.
I request Dr. Gupta to proceed with his lecture, and thank you very much.
So thank you, Dr. Adarshpal. Yeah.
Now I would request Dr. Rakesh Gupta for his presentation.
So thank you, Sanchika. So my presentation is on public health threats, electronic cigarettes or ENDS. So ENDS is the electronic nicotine delivery devices, right? So next, please. Delivery systems, rather. Next. So these different kinds of electronic cigarettes are available in the market. So it may look like a pen, or it may look like a flash drive, or it may look like a hookah. So electronics cigarettes, they are called as e-cigarettes, and they are battery operated devices. So many of you might not have seen actually. And these are designed to look like regular tobacco cigarettes most of the times. And they contain a nicotine-based liquid that is vaporized and inhaled. And it is used to simulate the experience of tobacco smoking. It is in the form of scientific language. It is, as I told you, it is called as electronic nicotine delivery system. Next, please. So this is a very latest awareness notice regarding the electronic cigarette ban. So this was published maybe 2-3 days ago. It was published in all the languages. So I've shared with you the English and the Hindi versions. And I have shared in all my social media handles, and you must also do this, because this presentation will be uploaded on the eco platform, so you can always download this presentation. And I really request all of you to share this with all the e-commerce sites so that they are made aware about the electronic cigarette ban, because they are flouting the ban. Next, please. So switching to e-cigarettes is not a healthy choice. This is for sure. So Dr. Pawan Gupta, Dr. maybe Rakesh Gupta is also with us from Rajasthan. So they are all expert in tobacco cessation. So they'll agree with me that it is not meant for tobacco cessation. Next, please. And tobacco cessation doesn't mean switching one addiction to other. So this is often claimed by the proponents of the electronic cigarette that these are good for tobacco cessation. So UK report that claiming electronic cigarettes, they are 95% safer than cigarettes. It is based on one industry-linked report questions Public Health England's scientific credibility. This was in British Medical Journal. So the link is also there. So if anybody is interested, they can read all the details why this is not a good study. Next, please. So I'll just talk about the side effects of the e-cigarettes. In low doses, it may cause nausea, it may cause vomiting, abdominal pain, eye irritation. High doses of nicotine may cause tachycardia, high blood pressure, seizure, coma, and even death. FDA reported detecting ethylene glycol in most of the electronic cigarettes, so which is a dangerous product to be added to these. And it causes and cancer-causing substances like nitrosamines, they are also detected in the e-cigarettes, e-cigarette vape, or the vapors. In addition, some electronic cigarettes, they have caught fire or are exploded because of the faulty batteries or malfunctioning battery charges. That is why, so you know that these are not being allowed to be carried in planes. Next, please. So if it, as far as the side effects of the brain is concerned, it causes addiction, and brain development is also hampered because of this. In eyes, it causes irritation, it may cause blurry vision, it may cause wounds and burns in case of e-cigarette explosion. It may cause irritation in the mouth and airways, cough, increased airway resistance, heart and circulation, cardiovascular system, it causes increased, before that, yeah. So it causes increased heart rate, it causes chest pain, it causes blood pressure. So you see the nicotine, it is a vasoconstrictor. So all the organs in the body, they need blood circulation. So it affects all the organs in the body from head to toe. In stomach, it may cause vomiting, nausea, and pain. Next, please. So the problems with e-cigarettes, as some of the points I've already highlighted, so it may cause asthma. The electronic cigarette use, we should avoid using this word. So I've not been able to correct this. So we should avoid, being scientific persons, we should avoid using vaping. So vaping, that becomes a very good thing to do. So it is the electronic cigarette use actually. So electronic cigarette use can make you more likely to get asthma and other lung conditions. It can make your existing asthma worse. Lung scarring is there, diacetyl, a chemical which is used for flavorings. It may cause bronchiolitis, obliterans, popularly known as popcorn lung disease. So bronchiolitis, obliterans that cause permanent scarring in your lungs. It may cause damage to all the organs. In addition to your lungs, nicotine and other substances in e-liquid can hurt your heart and brain, as I told you earlier. Brain element, raise your blood pressure, and it may narrow your arteries. In fact, nicotine chemical is a vasoconstrictor, so it narrows your all the blood vessels. So E-valley, it is a very common condition which most of the people in tobacco control, they know about it. So it is e-cigarette or vaping product use associated lung injury. So EVALI is a serious lung condition that vaping causes. It causes widespread damage to your lungs and gives you symptoms like coughing, shortness of breath, and chest pain. So EVALI can be really fatal. Next, please. So as we all know that nicotine is very highly addictive. It is more addictive than even heroin. So it causes changes in your brain. So you want more and more nicotine. You might not be able to stop using electronic cigarettes if you want to, or if it starts causing health problems. Even e-liquids that say that they are nicotine free, a small amount of nicotine is always present. It has been detected in the labs. So cigarette smoking, many people, they start using electronic cigarettes and end up using smoking cigarettes because those tobacco smoking is a much economical habit. So whenever a person has got money, they buy e-cigarettes, and when they don't have money, they buy tobacco cigarettes. So as we all know, the cigarettes, they contain all the harmful chemicals. The electronic cigarettes, as I already told you, they're not harmless. And so it leads to dual usage. And as said by many people who promote this use of electronic cigarettes, they say that there is no second-hand exposure. It is only water vapor. It is not actually so. So any one of you who have visited Europe mostly, so many people you will see smoking these electronic cigarettes, and there's very thick smoke. And this smoke that contains nicotine and other chemicals. It even contains heavy metals like cadmium and chromium. So explosion can also happen. There has been incidents of batteries in electronic cigarette devices exploding, and they cause serious injuries and burns. So, and it may even have some carcinogenic components also. Some ingredients in liquids are known to cause cancer. It may cause DNA damage. So that is the reason for causing cancer. Next, please. So I've shared some of the studies. Actually, this is the impact of electronic cigarettes on cardiovascular system. This is by the Journal of the American Heart Association. And the American Academy of Pediatric Dentistry recognizes the increased use of electronic cigarettes. So you may just click on the links and just go through the details. Next, please. So this is almost 3 years old study, actually. 2 new reviews summarize how e-cigarette, they adversely affect the cardiovascular system. So whole reason why the electronic cigarettes, they lead to cardiovascular damage, that has been mentioned. So you can just go through the details, and even the link has been provided. Next, please. So pulmonary effects of ends, as I already told you, and the American people, especially the American Lung Association, that they have published this study, and they say that 900% increase among the high school students. And this is, I'm talking about 11 to 2015. And now after the advent of June, so this percentage is much more now, actually. And there's another study. The study notes that while neutrophils, they are useful in combating pathogens, they also are known to contribute to lung diseases such as COPD and cystic fibrosis. The study also identifies similar increases in specific biomarkers associated with lung disease between e-cigarette and cigarette use. So there's some of the biomarkers, common biomarkers have been found. So they are common to electronic cigarette and cigarette users. So definitely e-cigarette is not a healthy thing. So next, please. And this is a very recent study. So cancer prevalence in electronic cigarette use, a retrospective cross-sectional study has been published, and the link has been provided. And the conclusion is that in the study, electronic cigarette users had an early age of cancer onset and higher risk of cancer. Hence, this is a stepping stone for future research to evaluate the safety and effects of electronic cigarettes in patients with cancer. So these proponents of electronic cigarettes, they always said that it really doesn't cause cancer, but they have been proved wrong. So it has been proved that electronic cigarettes can lead to cancer also. Next, please. So now recently we had a consultation on tobacco and electronic cigarette depiction on OTT platform by Netflix and their Sony Live and Prime, and that Amazon Prime Video. So this is the latest depiction of smoking cigarettes and electronic cigarettes as Saas Bahu or Flamingo. This is a serial being it is being streamed on OTT platform. And recently, in fact, today I have read this news that don't promote electronic cigarettes. So INB ministry that they have told media and the TV channels. So that is a very positive thing to happen after our consultation on 20th of April. Next, please. So we did webinars on enforcement of ENS ban in India. So ENS, as you must have come across this PICA 2019 Act. So under PICA 2019 Act, it has been already banned. And Madam Preeti Sudan will tell you the story behind the PICA ban. So she's going to join us very shortly. Next, please. So we had 2 webinars. So this was national considered by ENS ban in India and 40 other countries, 40 plus other countries, and how prohibition of e-cigarette act can be effectively enforced. So this webinar also happened, and we sent some recommendations to the government also. Next, please. So these recommendations were sent to various stakeholder ministries. So I'll just tell you the gist of the recommendations, but these recommendations for the Ministry of Health and Family Welfare. Next, please. So this is for the state governments, and state governments, they have been asked to integrate monitoring and PICA 2019 compliance with NTCP at the state and district level, and state level committees should also coordinate with enforcement agencies in tracking down electronic cigarettes and ENS and charging the violators with a suitable fine. So they should not be just monitoring; they should be charged with under the law. So there's 1 lakh fine and even 1 year imprisonment can be there if you are a manufacturer or seller of electronic cigarette. Raids should be conducted by authorized enforcement agencies on kiosks, especially those which are very close to schools, to seize banned electronic cigarette and ENS countrywide. So randomly on a regular and a sustainable basis. And there should be sensitization and training of the doctors and other healthcare professionals to promote and practice tobacco cessation according to Indian requirements. The Western literature has put electronic cigarette as an aid to cessation, and this is creating conflict in the minds of those healthcare professionals. So I think this webinar is also important as a capacity building workshop also. Next, please. So Ministry of Electronics and Information Technology, they were told that they should not be allowed the sale of the electronic cigarettes on e-commerce sites. Ministry of Home Affairs was asked to implement the kiosk and the PICA 2019 because Ministry of Home Affairs, the police department is meant to ensure the compliance of PICA 2019. Though in some other states like Haryana, they have even allowed the drug inspectors to enforce PICA 2019. We can also allow sub-inspectors above from state tax department, health department, transport department. So this is the prerogative of the state government. So the Director of Revenue Intelligence, in some of the states, they have done an excellent job, especially Gujarat. So I think all the officials of the Director Revenue Intelligence, they should also be told about this. And they can easily, under the Customs Act, they can act. So they can seize this material through the Custom Act. So next, please. So the key recommendations were to integrate monitoring and PICA compliance with NTCP at the state and district level. State level committees, this has already been told that they should ensure that all the enforcement agencies, they track down electronic cigarette ads and charge the violators with a suitable fine as per the law. And the raids should be conducted by authorized enforcement agencies on kiosks, sensitization and the training of the doctors. All stakeholder departments, including DRI, must be involved in enforcing PICA 2019. And lesson learned is that an awareness must be created in general public about the harms of electronic cigarettes, and all the stakeholder departments must act against the violation. So I told you there are many stakeholder departments like Ministry of Health and Family Welfare, Ministry of Home Affairs, Ministry of Electronics and Information Technology, Ministry of Information Broadcasting can also help, and all the the civil service organizations, they can also help in creating awareness about these issues. Even the academic institutes, they can also help in capacity building of the healthcare profession. Next, please. So since we have some time before Madam joins, so I may just tell you, so how this is being enforced actually. So we just had, in fact, this will come in the next booklet of this best practice, but I just give you a glimpse of what is happening in some of the states. So next, please. So these are the interventions they have, which have been done in Gujarat, basically. So the Gujarat government, they introduced a law banning the electronics and electronic cigarettes. This was under the purview of the PROTPA. And on 5th December 2019, as you already know, that PCAR 2019 was enacted. On 26 February 2022, Special Operation Group from Gujarat Police, they seized electronic cigarettes. So this is the list of activities which have been undertaken by the Gujarat government. And these can be undertaken by all the state governments, in fact. And this is the reason that these best practices have been compiled, will be compiled in the next booklet. So I may also tell you about the Punjab government, since Dr. Adarshpal, she did not mention the details, how we did actually. So this all happened in 2013, actually. So we had a meeting of Ministry of Health Family Welfare officials. So I went to the meeting with because I asked Dr. Secy.Health, who is additional DDG in Ministry of Health and Family Welfare. I asked for this meeting. So I went with the state drug controller. And Madam Shakuntala Gamblin was there, who was chairing the meeting. And after the meeting, she was very much convinced that electronic cigarettes. So I'm talking about 2013, when not many people they knew about electronic cigarettes. But she said that this should be banned, and 3 subgroups were formed. But in our case, the state drug controller was very proactive. So immediately when we came back to Punjab, he issued a letter to draw all the drug inspectors, and electronic cigarettes were banned under Drug and Cosmetic Act. So, and we actually we enforced the law in all the districts, and about 3 to 4 cases were lodged. And they did not appeal the High Court also, because we were on a very firm footing. So people went to jail, and they were sent to jail, and even a fine was imposed in Punjab government. And even the cyber crime wing of the Punjab government, they issued enforcement notices to the e-commerce sites that this is not allowed in Punjab. So there should not be any sale of electronic cigarettes in Punjab. So whenever any person who wanted to buy electronic cigarettes in Punjab and they put the PIN code, it was not delivered in Punjab. So that was the importance of those notices by cybercrime cells. So we actually faced tobacco industry interference also. So when actually we banned the electronic cigarettes, the e-cig manufacturer, there was by the name of Lifejoy, they came running to our Principal Secretary Health. At that time, Madam Vinny Mahajan was the Principal Secretary Health. They came running, and they submitted a bunch of documents that electronic cigarettes are very good and they are very good for tobacco cessation. So Dr. Rana J. Singh is with us. So he also knows about all the process we underwent actually. But I was able to convince Madam Vinny Mahajan that this is not the actually correct position. And electronic cigarettes, they are not meant for tobacco cessation, because for tobacco cessation, many FDA approved products, they are still available in the market, like tobacco patches, the nicotine patches, the nicotine gums, nicotine lozenges. So they are already present, and vernacular is available in the market, Indian market also. So there are many pharmacotherapy is available now in addition to the NRT. So this is not the right thing to do to promote electronic cigarettes. And this national NHS UK, they are promoting electronic cigarettes like anything. They are even providing these free to the people who want to be de-addicted actually. And in fact, they will be addicted to this nicotine or the electronic cigarettes. I'm sure about that. So maybe in 3-4 years, they will come to know that I think it is not a good thing to promote electronic cigarettes. And Government of India, I must say that they have done a wonderful job by banning electronic cigarettes. And this PICA 2019, Madam Preeti Sudan will tell you about the details. And it is a wonderful, very comprehensive act under which the electronic cigarettes have been banned. So, Dr. Sanchika, can you see that if Madam is joined? So she told me that she'll be joining around 5. But next slide, please.
No, she has not joined.
Okay, doesn't matter. So these are all the details of the activities which have been undertaken by the Gujarat government. Next, please. You can skip the table. So these are some of the media reports that Gujarat House that passes bill to ban import of electronic cigarettes. Next, please. So as I told you that in December 2019, so Government of India, the banned under PICA 2019. So this is the Gazette notification for that. Next, please. So this is the SOG sleuths. They are from the police department. They seized electronic cigarette. That was in February 2022. So I'm just quoting all the media reports. So in Kanraj, the police seized electronic cigarettes. This is another media report that was in August 2022. Next, please. So on 4th September, there were e-cigarettes were seized worth 20 crores in Surat. So these were done by the DRI, so Director Revenue Intelligence. So they have done a wonderful job in Gujarat. Next, please. So Ahmedabad, the DRI that seizes electronic cigarettes declared as toys. So they were declared as toys actually. And initially in Punjab, we found electronic cigarettes on pawn shops, in crockery shops, in toy shops. So these you can find them everywhere, but not now. But in earlier days, and now most of the times, electronic cigarettes, if it is present in kiosks, it is not given if you are not known to the person. But these are freely available on e-commerce sites. We have already found that. Next, please. So e-cigarettes worth 48 crores, they were seized by DRI. So it is not that nothing is happening on this front. So it is being actually enforced. The PICA 2019 and the under Custom Act action is being taken against electronic cigarettes. Next, please. So even in Garba, actually, there was a viral video that the lady was smoking electronic cigarettes, but people were aware. They give, they called police, and she was caught, and most probably under PICA 2019 action must have been undertaken. Next, please. Next. So this is the electronic cigarette seized at Ahmedabad airport. This was in October 2022. Next. So in Surat, smuggling via Gujarat feeds Mumbai. So you see, the smuggling was happening in Gujarat, but they were feeding some of the points of sale in Mumbai. So this has been found, and even in 2023, many actions have been undertaken. And these activities have been undertaken in Maharashtra also, in Mumbai. Next, please. So the cybercrime cell of Ahmedabad police had a 24-year-old man from Ellis Beach for alleged selling prohibited electronic cigarettes. So cybercrime cell is also helping out in enforcing the law. Next, please. So nicotine-laced cigarettes, they were found in Rajkot. Next. So this is the Ministry of Finance report that DRI seizes 40 lakh worth foreign cigarettes in financial year, and DRI seizes electronic cigarettes worth 138 crore. 138 crore is a lot. So this 138 crore worth of electronic cigarette must have gone to the e-commerce sites or to the kiosks. So this is important that we are aware about the activities of the smugglers and the manufacturers and sellers of electronic cigarettes. So we should not let it happen. So we must send complaint to the NTCP cell, maybe the state cell or or the government of India or to the police, to the nearest police station. Next, please. So multi-stakeholder and multidisciplinary engagement was there. So you see that the STCC, that State Tobacco Control Cell and District Tobacco Control Cell. So Gujarat government, as I told you, that they introduced in July 2019 a law banning the manufacturing, sale, import. That must have been done under Drug and Cosmetic Act, like in Punjab. As I told you that the Punjab, it happened in 2013, but before PICA 2019, at least 18 states, they had already banned electronic cigarettes under Drug and Cosmetic Acts, or some of the state even they use that Poisons Act against the nicotine. So Department of Home Affairs, Police Department, the Cybercrime Cell, they booked violators under PICA 2019. So this was a multidisciplinary approach. And as I told you, the Director of Revenue Intelligence, they played a very big role in seizing the consignments of electronic cigarettes. Next. So people and all stakeholder government departments, they are now sensitized to the provision of PICA 2019. And so action is being undertaken, banning e-cigarette, and Department of Home Affairs and DRI has already booked the violators and seized illegal products. Actually, some of the states, they are not coming up with the media stories. So we could find media stories from Gujarat, and one of our friends from Gujarat, Ms. Susan. So she gave us all these media reports, so we could compile this data. So that is the reason. But it is happening in other states also. Next, please. So what the challenges they are being faced, actually the tobacco industry, basically electronic cigarettes, they are being produced by the tobacco industry, which is marketing most of the electronic cigarettes, is interfering in enforcement of the PICA 2019 and lobbying with the high government functionaries to weaken the law. So as it happened with the COTPA, it is same thing is happening with PICA 2019. They're trying either to weaken the law or it must be repealed completely. The front group tobacco industry, the so-called farmer unions, they protested against Gujarat state law banning electronic cigarettes, and they continue to do their interference, and they just want to get the PICA 2019 relief and repealed. So sustainability of intervention is important in all the states because government of Gujarat is sensitizing the general public about PICA 2019. And this is being regularly monitored. The Home Department officials are monitoring during MCR meeting, monthly crime review meetings also. And Director Research and Revenue and Intelligence is regularly monitoring the seizure of these banned products in all meetings of the official. So that is the reason there is sustainability of the intervention in Gujarat. And I think this is a good practice to learn, and all the state governments and the UTs, they should learn from Gujarat and enforce the law. Madam Preeti, are you with us? But Sanchika, can you see that Madam Preeti is with us? Because she was supposed to join at 5. Okay, we'll wait for her. She's not joined. Okay, we'll wait for her. Next slide, please. So it has got a translatory value also. The interventions in Gujarat, they have a translatory value and can be replicated in all the states and UTs. And general public, especially the young kids, are benefited as they are saved from nicotine addiction and other health effects. As you see, these there are about 7,000 flavors of electronic cigarettes available. And it is very clear that the electronic cigarette manufacturers or sellers, they are not aiming at selling only to the adults, but they are aiming to sell more to the young adults who are not using tobacco earlier. So this is a very, very bad precedence for these younger kids. And it may be good for people who are using tobacco or they are smoking tobacco, but it is definitely not meant for these non-tobacco users, definitely. Next. So these are the references. So since this presentation will be available with you, so you can always refer to these. And if Madam Preeti Sudan is not there, so I can talk about electronic cigarettes at the national level. So how that electronic cigarette ban happened. So Dr. Sanchika, I'll call Madam to see if she has joined or she's planning to join. Otherwise, I'll continue, right?
Sure, sir.
And Dr. Rana, you may tell about how electronic cigarettes they were banned pan India. You can just throw some light on it. Dr. Rana?
I think you are aware of that all happenings. So thank you, Dr. Gupta, for this very informative session on e-cigarette. What is e-cigarette, how it is being marketed, what are harmful effects, how children and youth are being lured to it. In nutshell, we can say that public health and tobacco control is at danger. It will be harmed if availability of e-cigarette continues. It increases exposure to nicotine among youth and young adults. It leads to initiation of routine cigarette or BD. The combustible tobacco smoking. It also slows or prevents cessation of combustible products by nicotine addiction. So in that way, I think Dr. Gupta very eloquently he has told us about all the harms which e-cigarette can have. So he also mentioned about the first meetings which we all had in 2013. And this was the scenario globally also. When I learned something, when we were exposed to various sessions related to e-cigarette, so what should we do for the country in India? We have many laws. It is always very difficult to implement and enforce the laws. Everyone was asking, let's regulate e-cigarette. But perhaps it's good that we did not agree to a regulation part. Regulation means it should not be sold to people under 18 years. It should not be advertised. It should any kind of harmful effect if it has. It should be they should be communicated. So in that way, that is part of regulation. So it was a big challenge before us whether we should go for ban or we should continue. We should regulate it. There was a lot of at that time research happening across the globe, and e-cigarette was one area which divided the public health community. There were many people who were supporting that e-cigarette, presence of e-cigarette and trying to use it for cessation services. Similarly, there was one group which were against that. But for our country, I think we all agreed. We had our first meeting, ministry invited first meeting in July 2014. And all, many people, including Dr. Gupta ji, who is here on the call also, he was also there. So there was a meeting, high level meeting in Ministry of Health and Family Welfare. And there was clear, you can say there was an agreement that yes, it is in 2014. There was an agreement that yes, this product, so India should ban it. Then 3 working groups were created in the country. One working group was to look at harmful effects of e-cigarette. Second group was to look at its marketing or its maybe awareness about the product. And third group was about regulatory approaches. What should we do? So 3 working groups were created by ministry. Then all working groups had their meetings and submitted their reports. Everyone again agreed that yes, it should not be available, but still it took many years. But at the same time, sub-national level work, that is e-cigarette ban started happening at state level. So Punjab was the first state. Then there were many states, one by one. Union also worked with all the states, and one by one, many states they prohibited, they banned presence of e-cigarette in their state. So manufacture, sale, transport, so all those things that happened. Even a few orders also, there were district level orders also for banning e-cigarettes. So in that way, that helped the government of India. When 16 or I think 17 states, they have already banned e-cigarette at the state level, it made work of Ministry of Health and easier. And there was then the task was also given to ICMR, that ICMR came up with a white paper, which collected and brought together the essence of a whole scenario. And finally, that was prevailed, and Ministry of Health issued its first, you can say, first order about e-cigarette ban, and later on that became an act. So yes, now we have an act, Prohibition of Electronic Cigarette Act 2019. Now you see, it's very important that it is enforced. If you ask me what is current requirement, what is required, there is a law, it has to be enforced. Simple awareness generation will not be sufficient to keep it away. There are already efforts to see that this law can be changed. There are already efforts by even public health community, and many of these studies are funded by tobacco industry, which are sporting e-cigarette. Now there is dual use. The people who are using only smoking, they are also now using tobacco as e-cigarette. There are people who are starting with the e-cigarettes. It is likely that they might never have used tobacco, but because of e-cigarette, because of the marketing strategies of tobacco, they are the youth, they are hooked to now this addiction. So government of India has already very recently, government has again written to all the states to ensure effective implementation and enforcement of PACA, and prosecution is very important. Prosecution as per the law, who is violating the law, it's very important, and I think this must be done. So this is all of which I will like to add. Thanks to Dr. Gupta again and ECO for organizing this very important. I am good. I am happy that so many people are present in this webinar, and would be happy to receive your suggestions also. And now over to Dr. Sanchika and Dr. Gupta.
So Dr. Sanchika, Madam Preeti Sudan has joined. So you can just ask her to talk about it. So I think she may speak without PowerPoint also, or just ask.
Yes, I'll be speaking without.
Okay, no, it's all right. It's all right.
Because I am actually just out of a meeting, and in another 10 minutes I have to go for another meeting.
Okay, you can just talk extra for you.
Yeah. So anyway, thank you for inviting me, and it's great that you are sort of conducting these meetings, because you see, we have enacted PACA, as you know, in 2019, which is a great achievement. And it was at a time when, a major American company was trying to launch their product in India. And this was done after, I would say, overcoming lot of legal hurdles. It was an ordinance, and then finally it has become an act. And it is also very heartening that this act was passed by consensus of all political parties. I think that's the greatness of our India. And with this one act, we have really saved, I would say, the people of the youth, especially in India. But you see, the battle of compliance, the battle of enforcement, I'm calling it a battle because every day some new strategies are coming forward to bring, I would say, ends into the market. So therefore, I think we all, the civil society, the officers, the police officers, the administrative officers, all need to work together. And actually, I would say that the awareness of the ill effects of electronic devices, and I don't want to repeat what are the ill effects and all. I'm sure that my predecessor speakers have already covered all those aspects. Now, the important thing is that how do we ensure that there is strict enforcement and there is awareness? And as you know, in fact, the Honorable Prime Minister has mentioned this in his Mann Ki Baat also. So at the highest level, and it was only because of political will that India could take this, I would say, revolutionary step. However, still, lots needs to be done. So I would say that through your civil society organizations, and you must also, I think, work in schools now, make in parent-teacher committees, make the parents aware. Because what happens is that these electronic devices do not leave any smell of cigarettes, unlike other tobacco products. So therefore, even the parents don't know that, our child is smoking. So initially, when we were thinking about this of regulation and then ban, we found that, I won't name that public school, but we did conduct a survey in the school bags of children of 10th, 11th, and 12th class. We found electronic cigarettes. So therefore, it's important that we ensure our children are made aware of the ill effects, because this is pure nicotine. It's flavored, it's chemicals. It's even worse than a cigarette because it's direct inhalation by the child or by the user. So therefore, we need to take awareness needs to start from houses. Recently, Government of India has published advertisements, has had meetings with the states once again, when there were complaints of finding that there are, we do find electronic cigarettes in market. So I think the effort has to be continuous, number one. The effort has to be collective, number two. The effort has to be multi-pronged, number three. And number four, that wherever you find, instances of non-compliance of the act, it should be brought to the notice of your relevant authorities, whether it be district, whether it be state, or whether it be even I would say the Ministry of Health and Family, because we have commitment at the highest level. So I just want to today stress on compliance. You all know about the background and the circumstances in which actually we brought about this ban. We were thinking of regulation under the Cosmetics and the Drugs and Cosmetics Act. It was not possible. Lot of legal hurdles we faced, but this revolutionary step of a new act was taken, and through due diligence, it was committees looked into it. Then ICMR published a white paper. So there is scientific basis to our ban, and there is a political will backing it. And as I said in the beginning, that, this was passed in Parliament with the consent of all the political parties. So, which is, again, I would like to repeat, the greatness of India. So therefore, let's ensure that compliance is ensured and we all work towards it. And I wish your organization and Dr. Gupta and all associated with you, I congratulate you for keeping this topic, alive, and it is a continuous effort. Thank you very much for having me. I'm sorry I need to leave because I've come in between meetings. I'm still in office. So thank you very much.
And just a minute, if you can just wait for a group photograph. Just a minute. So Sanchika, so you can just have a snapshot, please.
Yeah.
All are requested to switch on their video.
Please switch on your videos, please. All may please switch on their videos.
I'm very sorry to leave like this, but I just...
No, it's okay. So I may tell you all that Madam Preeti Sudan was our former Health Secretary, Ministry of Health and Family Welfare, and she did a great job in tackling non-communicable diseases. The COVID-19 pandemic also she handled very well. And presently she is a member of the UPSC. So, and she, we all know that she's a busy person, but so thanks, Madam, for joining us. Thank you.
Thank you, madam.
Done, sir.
Thank you.
So, Sanchika, I think I'll like to ask Dr. Pawan Gupta and Dr. Rakesh Gupta because they are tobacco cessation specialists. So one by one. So first Dr. Rakesh Gupta, then Dr. Pawan Gupta. So they can just tell their views about the electronic cigarettes, please. So Dr. Adarshpal Kaur is with us. So ma'am, thanks a lot for staying with us for so long. But I hope that you like the presentations and you now know a lot about the electronic cigarettes and how to implement it. So thank you, ma'am. So Dr. Rakesh Gupta, your views on electronic cigarettes, please.
Thanks, Dr. Rakesh ji, and with respectful regards to Madam Preeti ji and Dr. Rana, and hello to everybody. Since I'm traveling in train, maybe there is a background noise there. I don't really have to add much except for the question that I have asked as to why in PACA the individuals have been in a way not included for the prohibition and the violence, the violation which is happening.
Yeah, it should be there.
That's a question that I wish to ask you, or was it just an omission inadvertently?
So I think Dr. Rana can take up with the Ministry of Health. So that should be included actually.
No. Just first is why it was not included. You see, Dr. Gupta, it is not that it was missed inadvertently. Definitely, there was a lot of discussion. There were legal peoples present also. So maybe by making a tobacco use, individual use. So they did not want. There was some kind of perhaps understanding that we don't want to make it to criminalize the things. Although definitely everyone wanted, but finally I think this was done. Even the draft which was present, I think again now Dr. Preeti, Madam Preeti is not here, but definitely there was discussion, and now whatever ministry and the overall legal opinion, so that prevailed upon the suggestions from public health, you can say, people.
Okay. So now I'll request Dr. Pawan to say a few words about how electronic cigarettes they can help in tobacco cessation or they should not be used for tobacco cessation. Dr. Pawan, are you with us? Or Dr. Dilip is with us. He can talk about it. Dr. Dilip Acharya.
Please unmute yourself.
Please unmute yourself.
Good evening, everybody. Thank you for giving me to talk. Actually, tobacco cessation the thing, cigarette has no role as such. Because it's just that it may be a beginning or a gateway to switch from cigarettes use also. So that's the point everybody is telling that, though it is propagated in UK and even Europe also for tobacco cessation. But as we said it, asman se tapke khajur pe atke in our this thing. So it is no use in this thing. So it has to be a total ban of that only. And we in IMA also are against use of e-cigarette in any way or in any form. And now it is officially banned also in India. That's it. And as I wrote just now, it was that many doctors also wrote against e-cigarette to the Ministry of Health. And I've been presenting my own work in 2015, then 18 and 19 International Forum also talking against e-cigarettes.
Yeah.
It's very now the.
And I may tell you, Dr. Dilip has taken up this issue very seriously, and they are actually in their jurisdiction. They are enforcing the law, I'm sure.
Yeah, thank you very much.
Thank you. And we have Mr. Gandhi, Ramesh Gandhi, and Dr. Jaskiran with us. So first, Dr. Ramesh Gandhi, will you like to add something? Or Dr. Jaskiran? Dr. Jaskiran, are you with us? She just suggested that.
Sir, actually, when you were mentioning about the nicotine, I thought that I know everybody is well aware, and it's a too small word to say that the electronic, cigarette contains more than why it was banned as a drug, why it was not covered, because normally our nicotine cessation has 2 to 4 mg, and the patch is also the similar value. So that has to be understood, that why nicotine, contained in the e-cigarette being the same drug, or it was harmful, and it was advised, and even the advisories were shared. So the advisory with reference to special, which already Dr. Rana sir has now mentioned, because that was previous to this thing, that the children, because they don't know, they think it is it is very attractive, and they use it. And now I am also taking it, being the RBSK, RKSK nodal officer. I am, wherever I get the chance to talk to the district nodal officers, I am requesting that when MHTs go, they should actually mention about e-cigarette to the children, so that they don't get lured by the sellers, by the attractive machines or whatever. First they are given the machines, they get used to, like as we said, it's a vicious cycle in the brain. Once the nicotine is in the brain, and you get to get more. And then thanks to when all these drives are conducted, so even in January, sir, I would like to mention that we conducted a 15-day drive. And the earlier drives were, of course, there pre-COVID. In 19, the 15-day drive was there, especially on Pekka. And Moga was one of the district which I was, in fact, on our TC Alliance group, I have been posting pictures and all the seizures which happened. So it was a very effective drive. And now we are looking to 31st May, of course. And the 15 days drive is coming. So these are few mentions quickly. And thanks to PGIMR, they conducted the studies also. So like the cross-sectional studies for this harmful effects of e-cigarettes, which has helped Punjab to stay on what you had planted in 2013. Thanks to you, that you did a big job in bringing a new thing, new innovation, new drive. And of course, I think 100 pages on e-cigarette mentioning in Punjab will not be enough. So these are few adding to what Adarshpal ma'am mentioned and you had mentioned. Thank you for giving me this platform to speak about e-cigarette.
Thank you, Dr. Jaskiran. So I may tell you that Dr. Jaskiran is SNO of NTCP in Punjab, and she is doing a wonderful job, and she is also undertaken some trainings with the union. So I'm sure that she will take the tobacco control to a different level. So may I ask Dr. Aruna DS with us? Dr. Aruna is with us, and Mr. Ramesh Gandhi. Dr. Ramesh Gandhi, are you with us? So after Dr. Aruna, yeah.
Yes, sir. So initially, like they were introduced, like in the name of the
You may first introduce yourself, please. Very short.
Sir.
Very short.
Yeah. Yes, sir. I am Dr. Aruna, a dental public health professional and a tobacco cessation specialist from Bangalore. Sir, actually, like they were introduced as a harm reduction product, electronic cigarettes. So like as used in the substance use disorder, so as to overcome the limit the harm caused by mortality and morbidity caused by the smoke. So a lot of like everything the cigarette harm was attributed to the smoke and its content. So now they came up with, but these products are not the risk-free products. Like so, anytime in the name of the matrix of the reduced risk nicotine delivery system.
The harm reduction is in fact a misnomer. Actually, this should not be used for electronic cigarettes.
No.
Because as I told you that electronic cigarettes, they lead to even cancer. So what to talk about other diseases?
So the harm. So initially these harms were attributed to the tobacco smoking, the cigarette smoking and all. So now these products are not risk-free products.
Yeah.
So it was a very good initiative to ban the e-cigarettes in India. And again, so these are not only for the nicotine, even for the non-nicotine delivery system also, the THC and other cannabinoids like. So the fluids are customized.
Yeah.
So that
Thank
is
you,
also
Dr.
an associate answer.
Thank you. So if Dr. Pawan is with us, because he's also tobacco cessation specialist, so can we hear from him if he's here? So Dr. Sandeep Singh, he's SNO NPCDCS. So Dr. Sandeep, are you with us? Okay, then I think we are already late by 6 minutes, Dr. Sanchika. So you can proceed with the other things we have to do. And then there's a feedback form also on the chat box. So you're all requested to please fill up that feedback form. Thank you. Dr. Sanchika.
Thank you so much, sir. So now this is time to wrap up the session. I would like to say that please fill in the feedback form, which is posted in the chat box. Your feedback is will be solicited for improving the sessions in the future. And also, I would like to inform about the next session, which is on 24th of.
So it will be on 24th of May.
24th of May, yes, 24th of May, and the topic is using PIL for advocacy in tobacco control. It will be taken up by our subject matter expert, Ms. Susan Sampson. So please do join us at 4 p.m. on the day on 24th of April, 24th of May again. Thank you so much for joining us today. We have seen a very good crowd today.
Dr. Sanchika, if Dr. Susan is there, Ms. Susan, so we can just ask her to tell us about the next.
She's not here.
She's not here. Okay, it's all right. Okay.
So we will see you again the next on 24th of May at 4 p.m. Thank you so much for joining us today. Bye-bye.
Okay. Thank you. Thank you all. Thank you all, please.